Alright guys, well thanks for coming out. We'll get started here right away. Really appreciate my dedicated group of people coming out on this holiday weekend to listen to me yap for a while. So, you all have been to my workshops before, right? I think you've been to one of mine. Yeah, you can do a couple of them. So, yeah, it's good. Yeah, that's a good one. So yeah, we do every single month. We take a different symptom or common complaint or question that we get in the office, and we do a workshop on it. And this one's usually a really big one. If we didn't do it the weekend of Labor Day, usually this is one that's really packed full, just like our low back pain. Because what do most people think of when they think of chiropractors? Back pain and neck pain, right? So it's the most common thing. This is like our bread and butter. Because we do this stuff very, very well. But you guys know, especially you guys, because I know you're dedicated parts of our tribe, that we do a lot more than just treat back pain and neck pain. I'm just going to move this thing so I'm going to trickle through. So this month we're focusing on neck issues. And when we're talking about neck issues, it's really a big factor. That'll be good.
Well, you're having a good night tonight, aren't you?
Space bar. Tech neck. Has anybody ever heard this term before?
Oh, yeah.
It's becoming a phenomenon. This isn't something we made up. This is actually what they're referring to it as now. So it's our cell phones, it's our technology. We do so much of this these days. It's our laptops, our tablets and stuff like that. So if you remember when we all looked at your x-rays once upon a time, do you remember I was talking about the way the curves should be? That neck curve should be that nice backward shaped C curve. Well, when we spend so much time in that prolonged state of flexion, that curve starts to straighten out first, and then worse, reverse in the wrong direction. And it's causing a lot of problems. It's causing a lot of health issues, especially in our younger populations, but I see it in a lot in our older populations now too, because who here has a cell phone? Everybody, right? Everybody today has a cell phone. Whereas I can even remember a day when I was younger, this is dating myself a little bit, they didn't exist. Maybe they existed, but I was, believe it or not, I know I look young, but I was young enough that, or I'm old enough that there was a day when my brothers and my neighbor kids would be out playing. Mom didn't call our cell phone to get us back in. She stood on the back porch and screamed our names. Eventually one of the kids heard and said, "Hey, Eric, Jim, Mike, you got to get back to dinner." And that's how we did things. And life has just changed so much. And unfortunately, a lot of the technology is really great. It provides us a lot of opportunities, but it's at the cost of a lot of our health and a lot of the common sense things that we just don't realize are common sense anymore because we're just inundated in this stuff. So tech neck is a big topic we're going to talk about. It can lead to lots of chronic problems, including things like bulging herniated discs. So, neck problems. There's a whole slew of things that can result from problems in the neck. You can read through the list. Pain, stiffness, tightness, loss of range of motion, all these kind of things. What a lot of people don't realize is even things going down into the shoulders, the arms, the hands, the fingers. That's where all these nerves start. So you can see things like shoulder pain, upper extremity issues. Headaches are another really common one. So the neck, it's the conduit between our brain and the rest of our body. What's the most important organ in the body? Come on guys, you gotta answer these.
In the body or on the body?
In the body.
In the body.
Your nervous system, your brain, the central nervous system, followed by that spinal cord that comes off it, and all those nerves that branch out. Everything's got to go through that neck at some point to get to the brain and get down to the body. So it's a really crucial spot in the body. And now, so you guys have seen this graphic before. You've been to my workshop. It's a perfect graphic for describing the difference between symptoms and problems. Because what's the symptom on this picture?
The top.
The little itty bit of ice sticking out of the top of the water, right? What's going to sink your boat? It's that huge iceberg underneath. And I know I've talked about this one with you guys before. We could chisel off that iceberg on top, that bit that's sticking out of the water. Pain's gone, right? Symptom's gone. Problem's not gone, right? That bottom's still there. What happens when we come back 3 months later, 6 months later? You got ice sticking out of the top again. The symptoms are back. And what's happened to the problem? Typically gotten worse too. So it's not just still there, it's progressing worse. So that's a great graphic to explain the pain symptom paradigm. And then the health continuum. We all know we're on this continuum, especially the people in this room, because I know you're my frequent flyers for these workshops. I know you guys have seen this one before. So where do we all want to be? We want to be over here or over here? Over here, right? Where do I meet most people? Over here. And it's not oh, I got some signs something's wrong. It's usually I've had signs and I got a little crick in my neck. It's hard for me to turn my head. Oh, it's a little bit hard. I'll just turn my body. Now I've ignored the signs for a while. Now I've got full-fledged symptoms. Often I meet somebody between symptoms and disability, because it's usually when they get the symptoms, they have the problem so long, now it's interrupting what they want to be able to do, what they need to be able to do. That's when I meet people the first time, the majority of the time. I can probably count on both hands and have fingers left over the times in my 7 years of being a chiropractor that I've had people show up being like, hey, I feel great, I just know I should get my nervous system checked and my spine checked, and I'm here to do that, I don't have any symptoms. It's happened very few times in my career. I would love it for it to happen, and I always get excited when that kind of thing happens, but it doesn't happen very often. How much of your nervous system is responsible for pain? You guys remember this one? Is it a lot or is it a little? I get you every time on this tiny little itty bitty bit.
10%?
10% or less. I always say 6 to 8%. It's not, somewhere between that 6 to 10% is responsible for pain. So I always like the smoke alarm analogy. Pain is your smoke alarm. It's your body's way of trying to signal there's a problem here. If your smoke alarm's going off in the middle of the night and it wakes you up, what do? You get up and find out why, right? You don't just go, oh, smoke alarm's going off, probably just the battery, I'll just go roll over. You get up and find out why. But when we have pain, when our biological smoke alarm's going off, what's the first thing many of us often do? Reach for that little bottle behind the medicine chest, right?
Yeah.
Some Motrin, some ibuprofen or something like that. Pop a few pills, pain goes away. That kind of thing. We don't really fix the problem. We take the batteries out of the smoke alarm. We don't figure out what the problem is. We just ignore it. Then our iceberg starts getting worse. So pain is such a small part of the equation. That's why I never tell people, hey, you feel good, you look good, you're healthy. There are many more things, many more factors that we have to take into account, okay? So, better premise. There's got to be a better way to look at health. And that's one reason we do these workshops every month, is we're trying to change our definition of health care. Because we have health care in our country, right? We call it health care. But what is it really?
Dishing out money for something that doesn't really help.
Well, yeah, there's that aspect of it too, yeah.
It's a big
It's a Band-Aid, yep. It's sick care. When do we go see the doctor typically? When I've got a problem, right? It's not like I preemptively, and there's more of a push these days to do the preemptive stuff, but we're still, by and large, we wait till we have a problem, or we wait till we can't ignore our problem anymore, then we go see the doctor. So I'm going to go see my MD now. What's the MD give me? Medicines, right? Drugs and surgery. And it's not that, I'm not trying to disrespect the MDs. They're all, I believe in my heart that most of them, if not all of them, have good intentions. But if you give somebody specific tools to work with, they go to those tools. And I always like to qualify that with, qualify it, that's fine. I'm a chiropractor. I'm biased to checking the spine, removing irritation of the nervous system in the spine, and that's my first approach whenever somebody comes to me with a problem. And there are people that come to me with weird things, not just the back pain, neck pain. And usually my response to them is, I don't know if I can fix this problem. I know I can check your spine, and I know I can find irritation in the spine where the nerves aren't communicating their end organ as well, and I can fix that problem. And if that's what's driving the problem you're coming to me asking me about, then potentially I can help. And I've had many, many cases in just my career. I know if you added all three of us doctors that hold potential together, the amount of miracles that we've witnessed in the short amount of time that we've all been practicing in the grand scheme of things, even though Dr. Ron's been practicing close to 20 years, we've got probably 30 plus years of collective experience under our belt, the number of miracles that we see. And I'm talking about the things that someone comes in for back pain or the neck pain, the classics. And then as we're treating them, they notice like, hey, my heartburn went away. Or the clicking I had in my throat every time I swallowed went away. Or my blood pressure started getting more normal. Or my IBS got better and I stopped taking the medications that I was on. We see all kinds of stories like that. And I don't tell necessarily somebody with IBS, say if I adjust you, I'm going to cure your IBS. Because there could be other factors in there. But I know that even if somebody has IBS and I clear out the spine and the spine's working like it's supposed to, the nervous system's working like it's supposed to, you think their intestines are going to be better or worse able to function after that? It's going to be better, right? So that's really what it's all about. So we got to set some new rules when it comes to our health. First is healthy normal. Yeah, we're designed to be healthy. Now sometimes we make decisions that are counterproductive to that. Sometimes our environments are counterproductive to that. But we are all designed with all the genetic makeup and everything we need to express perfect health at all times. Other than there are outliers out there. I mean, some people do have genetic disorders from birth. They just get that bad shake in life. But even them, they have a lot of factors that will allow their body to express a high degree of health. Then we have, is your body smart or stupid? Crazy smart, right? I know I've talked about this one all the time. I'm sitting here talking to you. I'm vibrating some vocal cords in my mouth. It's shaking the air. It's hitting your eardrums. You're interpreting this. It's becoming language in your mind. You understand what I'm saying. All this without even really having to think about how does all this work. Or everybody's heart's beating right now. Everybody's lungs are breathing. You're about to be digesting some delicious food in just a moment. All these things happen without us thinking about it, without us being conscious of it. That's the miracle that's in each and every one of you and each and every one of us. That's just how we are. But a lot of times we take it for granted, don't we? Why do you think we take it for granted?
It's there and
We get it for free.
it's
Yeah, we get it for free. I was born with this body. I got it for free. I didn't have to invest any money in it. I've even seen people like my equestrians, my people who own horses, they'll shell out a lot of money taking care of their horse before they'll put money on themselves. Or like even me, I'm guilty of it. I've got 3 cats. I've probably spent more on vet bills than I've spent on medical bills in the time I've had these cats. Because I love my cats, I take care of them. I take care of myself too. But I just don't go see the MD for things like that, okay? So then there's the nervous system. We just talked about this. The master system controls everything in the body. Everything is coordinated through the nervous system. Brain is the central nervous system, followed by the spinal cord. That's very important too. It's an extension of the brain. Everything in your body, every cell, every tissue, every organ, everything in your body ties into that nervous system in some way at some point. Your spine. Bone is the hardest substance your body creates, right? Your intelligent body knows it has to protect its most valuable assets. The skull is the brain is the only organ in the body encased in solid bone, other than a few holes where things pass out of it. The spinal cord is ring after ring after ring after ring of solid bone. Why? Because your smart body wants to protect its most valuable assets. And we have things like ribs and stuff like that that protect a lot of important things, but I always like saying it like this. My heart could stop beating right now. I could have a heart attack. If one of you came up here, started pumping on my chest, maybe blew some breath in my throat, and we got that thing going again before my brain died, I would still make it. My brain stopped working right now. If I was brain dead right now, that's it. That's game over. So that's the difference between important organs and the master organs, okay? And then the silly question. Do you think your lives are stressful?
Well,
Yeah.
I mean, I'm retired, so that part of my life isn't stressful, but
Yeah.
I still have the stresses.
But yeah, no, that's one thing
That's it.
the way I like to phrase it, you said it, you hit it right on the head. Your stress never goes away. Your stress might change. The stresses I have now as a doctor are much different from when I was a student, are much different from when I was a little kid. They'll be much different from when I'm retired. But stress is a constant in life. Now the forms of stress often change, but you cannot get rid of stress. And is life getting more or less stressful in this modern age? More stressful. Last year it was less stressful than this year. Next year's probably going to be more stressful than this year. Life gets more stressful as we go along. So we've got to start doing things proactively to counteract these unnatural stresses that we're bombarded with on a daily basis. So the stresses are 3 types. There's thoughts, there's traumas, there's toxins. What we think, what we do, how we move, what we eat, the environment around us. These are the major forms of stresses. And when we're talking about physical stresses, there's your macro stresses. That's like I fell down the stairs, I got hit by a bus, that kind of stuff. There's a point A, there's a point B, and something happened in between, and that changed everything. The insidious ones are the micro traumas. And look at what everybody has in their hand there again. That's a recurring theme we're going to see tonight. The micro stresses. You guys remember, I think I've talked to you, do you remember this one? How long does it take before your body starts changing the anatomy? If I'm holding my neck like this, how long does it take for my brain to respond and say, okay, we're holding things out of position, I've got to adapt and accept this as normal now? How long do you think?
Well, it should be immediately, because
I like how you're thinking, but for it to start making physiological change, you got about a 15 minutes or so. So if I'm sitting on my phone for 15 minutes, after that 15 minutes, my brain starts to think, okay, he's holding this position for a long time, I got to start modifying this. How often do you think people are on their phones alone today? A lot longer than 15 minutes, right? I mean, I've been guilty of it myself. You get on a Netflix binge or something like that, next thing you know, it's been like, geez, I've been sitting here for 3 hours, my legs are asleep, and like, that's your body's way of trying to, hey, get up and move some, okay? This is a great graphic. There are studies that show us for every inch we go forward and down is adding somewhere between 15 to 25 pounds of pressure for all these structures in there. So think of your head like that bowling ball. I think I've used this analogy for some of you. Big old bowling ball, about a 12-pound bowling ball. This is the neck, this is the head. This is good mechanics. This is not good mechanics. For every inch you go forward and down, it's adding a lot of stress and strain on these structures back here. Subluxation, our big fancy word, this is what we look for as chiropractors and correct. It's not as simple as just a bone being out of place. That's a big part of it. That's what starts the cascade. But once that bone's out of place, we have soft tissue damage. We get some disc swelling, some herniation, or some bulging, some inflammation, irritation. Now the nerve root is irritated. That creates muscle spasm. Why is the muscle spasming? I think I pick on you every day. If you were about to punch me in the stomach right now, what would I do if I see it coming?
You're gonna try to protect yourself.
I'm gonna guard, right? I'm gonna flex my gut, try to protect it. Same thing with all those paraspinal muscles that run up and down. Same thing with all the muscles in the body. The brain's first line of defense against irritation and injury is it's gonna splint it. It's gonna guard up. It's gonna say, okay, I don't know what's going on in there, but I'm getting lit up by something. Muscles, you're my first line of defense. Lock things down, don't let it move. Then we have loss of imbibition. Imbibition is that big fancy word for that pumping action that keeps your discs hydrated and healthy, okay? So it creates motion to keep your discs healthy. And that's why it's so crucial. That's why when we tell you, we want you to get up and walk after your adjustments and things like that. We're trying to push the fluids and nutrients into that disc space, push your waste products out of that disc space to keep it hydrated and healthy. Now we have joint fixation. It's no longer just misaligned, now it's stuck out of alignment. Then we have elevated stress hormones. I think that's my next slide, the stress response. You guys have all remember my analogy of being attacked by a bear, right? I've said this one to everybody in this room at least a few times. I'm being attacked by a bear. What's my body's first priority? Survive, right? I either got to fight that bear to the death or I got to get my butt out of there. So it's doing all these things. It's elevating my blood pressure. It's getting my heart beating faster. It's pumping the blood to the extremities because that's what's either going to help me fight back or get away. If I just ate, it's not digesting anymore. It's not worried if I'm fighting the sniffles about fighting the flu bug or the cold virus. It's worried about fighting the bear because if I win the bear fight or I get away from the bear, I can fight the cold another day. We have all this stuff going on as a defense mechanism, a survival mechanism. But now the bear is no longer a bear trying to kill me. The bear is my student loans looming over my head. Or, I don't know, dealing with a divorce or a death in the family or any of the things that stress us out, that cause us anxiety. That's the stress. And what we're finding in our modern society is we have these stressors. These stressors never go away completely. The bear's never not in front of us. Now we're at this elevated level of stress response, and it's leading to things like the elevated cortisol, burnout. That's what's causing a lot of our problems. That's what causes a lot of our subluxation issues. So now we have all this stuff going on, and we start getting things like arthritis. Remember what arthritis is? It's chronic irritation, chronic inflammation. Over time, your body responds to that stress by remodeling the bones. It's called Wolff's Law. Bones remodel based off the forces going through them. So I like the analogy, compare Dr. Matt to me. Dr. Matt, a CrossFitter, he works out. He works out a lot, right? If you were to dissect out my skeleton and his skeleton, all of his bones, all those places, those muscles anchor into his bones will be a lot more pronounced and defined in Dr. Matt than me because he's stressed them a lot more. The same concept goes if there's a joint out of alignment. So say I'm stuck to the side of it. It should be straight up and down. Now there's always more pressure right here. Eventually the body starts responding to that. It's going to start buttressing up those bones. It starts laying down more bone, trying to keep the problem in check. Now that adaptation is not a good thing in the sense of that change is permanent. Once that arthritis is in there, it's there for good, unless you get in there and grind it away. And that's often what they do when the problem gets bad enough. They'll get in there, they'll grind away that extra arthritis. But a lot of times, by the time they've gotten to that point, now they're taking out stuff your body's laid down to try to stabilize that joint. You got a loose, sloppy joint in there, they're fusing that thing by the time they're done. They're drilling some screws in there, they're pinning those screws together. Now they've taken out the motion, you're fused, okay? So that's why we try to be preemptive about explain this is what goes on. Get people to understand so they don't have to make those faceful decisions in the future. So again, pain, small part of the equation. It's such a small part, we don't want to rely on it to tell us when there's a problem, where there's a problem, or how severe the problem is. Your nerve supply. Your nerves control everything in your body. I love this diagram, or this graphic, because you see this, the circuit breaker, right? The nervous system, the spine's a lot like your circuit breaker. So your power goes out, or say some of the lights go out in my kitchen. I go check my circuit breaker, right? See if the breaker's split. If it is, I trip it on, everything works again. Let's apply that to our spine. The nerve that comes off down here, that one that's flat, you guys can see that? Say that goes to my bladder. And all of a sudden, I'm having a hard time holding it in, or I'm having a hard time going. Or say that nerve goes to my stomach and my esophagus, and I'm getting this constant acid reflux, I'm getting this constant heartburn. The problem's not a lack of Tums in the system. The problem's not the food you're eating. The problems are the nerves that are controlling those organs not working properly because there's irritation on them, and that causes all kinds of problems. That's why when we talk about we can help people with the miracle things that I was referring to earlier, that's why they happen. Because as chiropractors, we unlock the nervous system. When the nervous system functions like it's supposed to, the body functions a lot better like it's supposed to. So subluxations, I know we're beating that one to death, but lots of issues can come from subluxations, okay? It's not just some neck pain, some back pain, okay? It's everything on this list, and a lot more can be caused by irritation on the nerves, caused by a bone being out of alignment, causing that whole cascade we looked at on that other slide. And that's a good picture of a subluxation. That's a nice illustration. You can see the soft tissue and the disc and everything. Look at that bone. See how that's remodeled? Now I see, that's arthritis. I see stuff like this on people's x-rays. Say they're older. Say they're in their 60s, 70s, 80s. And they're looking at that and they're like, well, I'm 80 years old. It's normal for me to have arthritis. And it's like, yeah, it's a really common thing, but let me ask you, how old is that bone? This person's 80. Say this person's 80. It's an 80-year-old bone, right? How old is that bone? Also an 80-year-old bone. So if this was a normal part of just turning 80, why doesn't all of them look like that? Because it's not a normal part. It's a normal response to a problem. It's your body's way of trying to deal with a problem. But it's not just a normal part of, well, I'm hitting 60, now everything's just going to start falling apart and degenerating on me. If we keep it active, we keep it moving, we keep it aligned, we keep it healthy. I've seen people that are in their 60s, 70s, they have beautiful looking spines. Flip the coin, I've seen kids that are very, very young with horribly arthritic spines. I'm thinking about, there was one kid that was almost ripped in half by an ATV when he was like 9 years old. I met him when he was 14. Lots of arthritis in his spine already because he had horrible, horrible traumas when he was young. So neck pain, a lot of the time the issue starts at the top, it can go all the way down below the neck. So right in that mid-back area in here, how would that affect my neck? What ties into all the bones in my body?
Your nerves.
Your nerves, yep. So muscles. You have a lot of muscles that tie into your nerves, or your bones, right? So say I have a subluxation in my upper back. Those nerves go to supply some of those muscles in my upper back. Now those muscles are getting tight and pulling on things. Some of those muscles that anchor down here, anchor up here too. Now it's starting to play that tug-of-war game. There's those asymmetrical pressures, there's those tensions going in there. And that can be one way that things start to cascade over. Same concept. I get people that, I came in, my hands are numb. I got carpal tunnel syndrome. It's horrible. I can't do anything. And I'm doing my exam, where am I looking? My neck, their neck. And they're like, Doc, you're crazy, the problem's down here. And I'm like, no, that's where the nerves start. I get there might be problems going all the way down the stream. This is my specialty for one, so I'm always going to check the spine. And then we start teasing about where are all the insults to the nerve. We try to get to what? The cause of the problem, not just address the symptoms. Again, this graphic is a great reminder that forward head posture is really detrimental to our health. Unless you let it go for too long, then it stops being a problem because everything just falls off. So, how do we find these subluxations? If you have 6 to 8% of the nerves, say 10% of your nerves relay pain signals in your body. I've got a subluxation, I've got nerve irritation, but it's not lighting up that 6 to 8%, that 10%. So I don't feel the pain. How do you know it's there?
When I had my neck problem, which I still do at times, I couldn't move it.
That could be, you could experience loss of motion and stuff like that. Say you can move fine. I have good motion. I don't hurt. How do you know you're subluxated?
Well, you'd have to go have an x-ray.
You gotta be checked. And x-rays is part of the check. That's part of the evaluation we do on everybody when you first start.
You can't-
That's our job.
You can't see what's
You gotta come-
inside unless you've got.
Yeah, you gotta come see us and you gotta check it. And that's like, it's almost like, how do you know you have a cavity if the cavity is really early? It's not to the point that it's causing pain or problems or anything. It's not like my teeth are rotting on my head, but I got a cavity. You go to the dentist, right? The dentist checks you every 6 months and they say, hey, you got a cavity. And then this one kills me because I get some people that, well, you can't make the problem go away completely, or I feel better, or I've got degeneration in it, you can't fix the problem, I'm just not going to get adjusted anymore. Have you ever went to the dentist and got a cavity? Has everybody here has had at least one cavity in their life?
Yeah.
So you brush your teeth every day, right? I just went to the dentist for the first time in a while. I had 2 cavities. I brush and floss my teeth every day, twice a day, sometimes 3 times a day. I didn't be like, well, this is bull crap. I've been brushing my teeth, flossing my teeth every single day all my life, and here I am, 2 cavities. I've just given up on that. That doesn't work anymore. What would happen if I did that? I would lose all my teeth, right? But that's the same mentality a lot of us take when we're approaching our spine and our health. I don't feel it. I can't see it. It's not a problem. But a lot of times it is a problem. It's a problem we're not aware of until it's to that point of it's that big problem. We're way out on the bad side of the spectrum. I've got not only signs and symptoms, I got disability. I'm losing out on the things I want to be able to do in life. So you got to get checked, okay? So there's a 3-legged stool that we all approach to correcting problems in our office. The first is what? Eliminating the bad habits. The bad habits. The technique things. That's one of the biggest ones when it comes to your life. There's specific stretches and exercises. I think we've all done these ones. Do you guys remember these ones? You will love these? How often should we be doing these? Daily. How many times a day? I would say every 2 hours. If you got a job where you're doing something like this, you're working charting, like especially you're doing your charting and stuff like that, you want to counteract your hours of having to spend in flexion with some extension. So that's where life extension comes in. That's why we call it life extension exercises. But you will love these. You make a Y, YMCA. Nice and tall and proud. Tall spine, arms up, thumbs to the back. Bring it down into a W for the you will. Love. See the L? So love, getting those hands back there. I want to feel that in between my shoulder blades. T. You will love these. Bring it back as far as you can. You can feel that when you do it. And ideally, you don't want to see your fingers in your periphery. You want, I'm thinking, scratch the ceiling or the wall behind me with my elbows if I'm doing my W. I'm thinking L's, I want my fingers, if I'm wiggling them, I shouldn't see them in my periphery. I want to challenge that. Now, for some of you, you might try these and you're like, well, he was way back here, I'm right here, and this is a little uncomfortable. I don't want you to push through a lot of pain to get that, but I want you to challenge that because over time, this is what I had when I started. A couple of weeks later, maybe I'm here. A couple of weeks later, maybe I'm here. Eventually, you'll make improvement. You just got to keep challenging things. Then there's getting checked. So when you're getting checked, you mentioned that x-rays. That's always a part of our analysis when they're necessary. We also do thorough scans in our office. Figure out where the nerve irritations are to help us figure out what the best solutions to them are. Then we do our palpation. These fingers, I spent a lot of time, Dr. Matt, Dr. Ron, spent a lot of time training these fingers to find these subluxations. And I trust my fingers very much. There are people sometimes we adjust without taking x-rays. I very much trust these things to find and correct those problems. But you're absolutely right. When you say you got to see what's going on in there, there have been many, many cases where I know I could have adjusted somebody and they would have been fine. But I like to err on the side of caution. I like to see what I'm working with before I see it, and I have sat more times than I can count on one hand, probably 2 hands at this point in my career, where I've seen something on an x-ray that made me step back and say, okay, whoa, we got something else here. Maybe this is an abdominal aneurysm. I got to get them referred to their family doctor to make sure that they're aware of this because they got to monitor this thing. I'm not going to treat their aneurysm. That's not in my scope of practice. It's not what I specialize in. But I found it. I saw it. I refer them to their family doctor, so someone's going to make sure to keep an eye on it. Or maybe I find a weird spondylolisthesis where that bone slips forward and it's no longer sitting on top of each other. It's slipped all the way forward. Maybe I feel a divot in there, but I'm not 100% sure what's going on there. I see a picture and I'm like, okay, I know I definitely don't want to drive forward on 5, because 4 is already way down there. I got to work on trying to bring 5 back in alignment with 4 type thing. So those pictures give us a lot of valuable information, and that's why we do take x-rays in our office.
And another thing is insurance wants those x-rays.
Yeah,
Or
a lot of the
you
insurances,
know,
that you
you
got to
don't-
do some kind, you got to prove the medical necessity for the insurance company.
Yeah.
And there's lots of ways we can do it. X-rays are a really good way of proving medical necessity for an insurance company. But quite honestly, jump through the insurance company's hoops are the last reason I ever do anything.
Oh,
I do what I got to do for the insurance company to keep them happy, but anytime we're doing any kind of procedure, diagnostics, whatever, we're doing it for the specific purpose of trying to figure out what's driving the problem, what's the best solution to the problem, not just to satisfy the insurance company. Although you're absolutely right, there are a lot of hoops, and that's only going to get worse with time, unfortunately. That's the reality of insurance. So ultimately, you got to get checked to find these problems. Now I know you're all getting checked. I know most of you got adjusted this week, if not within the last couple weeks. I know you guys are believers because you come to my workshop very often. Unfortunately, I know we don't have guests here today. This is where I would offer to have the guests come in, get that full comprehensive exam. It's normally a $300 exam, $290. When we do these workshops, we offer them for $20. Not that I want to give away the care or anything like that. It's more of a motivating thing. It's something, it's out of love that we do this. And we specifically say, today is the only day we can do it. If you wake up tomorrow and you said, hey, I want to get checked, it's back to the normal price. Because procrastination, I think that's my next one. Procrastination is our biggest enemy when it comes to our health. And we've all said it, right? What's the 5 most dangerous words when it comes to your health? Maybe it'll go away, right? We've all said it, right? We've all been there. And then what happens? It went away, right? Maybe it did. I'm fine. My problem went away. What happens a lot of the time is you have this pain stimulus. So if this is a nerve, this is like the graph of a nerve, and this is the threshold the stimulus has to get to, we get that stimulus. It's not hitting that yet. Now it is hitting that. And it's hitting it all the time. I've got pain. This sucks. Then after a while, my pain goes away. Did the problem go away? That stimulus go away? Or did maybe my body adapt? And now it says, okay, if this is what I've got to experience pain, I'm going to up the ante. I'm going to make it so I've got to experience more problems to actually trigger it as pain, because I don't want to be interpreting it as pain. It's almost like going nose blind. You ever walk into a room and it smells like garbage? And then you hang around for a little bit, and you don't notice anymore, and then somebody else walks in and is like, oh, why does it smell like garbage in here? And you're like, oh yeah, it did smell like garbage when I walked in. Because your nervous system adapted to that noxious stimulus. So, I will open it up to you guys. If you know anybody that you want to get checked, you can buy them that invitation. It's $20. If you want to get a whole family checked, I've had some people do this. They get their family checked, or they get, like, I got my daughter that I'm thinking, I want her whole family to get checked because I love my daughter and their family, and I want them to last forever. They buy them it's $35 for family, it's $20 for a person. If you guys have anybody in mind that you're thinking of that should be here today, you can buy it for them.
I know so many people, but how do you convince them when they have in their head that that's
You know what? If you buy them the invitation and you give it and be like, hey, I got this for you. Now you spent money on an invitation for them. They might use it, they might not. I have seen, not a lot of people, but I've seen a few people buy invitations for people at these workshops. They don't use it. But what did you just do? You planted a seed. You keep watering that seed, eventually it'll grow. Okay? Some people need to be exposed to something 7 to 20 times before they're going to make a move on it. And sometimes it's that one seed that you planted way back in the past, when they finally hit that point of crisis, when they're finally at that point of like, I just can't deal with this anymore. And then they start thinking, well, for the longest time, she's been telling me to get in and get my spine checked with this chiropractor. Maybe I should do it. And then they come and get checked. And then I'll tell them, well, I wish we had checked this 10 years ago, but then you look real smart. So that's what I would encourage you to do. And if you don't want to make the investment to do that, then I would just keep recommending gently. You want to gently nudge, you want to gently coax. You don't want to try to force them, because you try to force them and they don't want to do it, you're going to turn them off to it. But I've seen a lot of cases like that, where a husband or a wife or a daughter or a brother or whatever, trying to get somebody they care about in the office to get their spine checked. This person is resistant, and I always tell them, keep watering the seed, keep watering the seed. Eventually something will grow. And eventually something does grow, and we usually eventually see that person.
But they don't understand, you know, that all this, the knee pain,
Yeah.
everything.
So what I want you to do next time, next workshop, invite those people. Invite them all. Don't even tell them you're doing a workshop. Just be like, hey, I got a dinner. I'm taking you out to dinner. If it's a dinner workshop. I'm bringing you out to dinner. And then when they get there, I got them. They're in my captive audience. They have no choice. They got to sit there. If they want to get out and walk away till they run the dinner, fine. Then that's their loss. But no, seriously, that's why we do these things. It's to get the people you care about that maybe don't get it yet. It's not that they can't get it. It's just they've grown up in a model where it's I go to the doctor gives me a pill, the pill makes me better, and that's how I address my health. And we know there's a better way. Everybody in this room knows there's a better way. Everybody out there doesn't know there's a better way. That's why we do these. We want you to join us in our mission to change healthcare. We want you to go out and sing it from the rooftops like, hey, we got this great thing, just come in and get checked. And if you really want to try to coax them and do it, be like, hey, I just spent $20 on you. I really would appreciate if you did this. Or I really would like you to do this because I care about you. And sometimes just phrasing it like that, I care about you. I want you to check. If they show up, we do our full exam and everything, and they don't do anything with it, that's them. But at least they know they got checked. They'll see their pictures. Sometimes that's all it takes. You get them there, they put the view box up, on the x-rays up on the view box, and they're like, holy crap, that's my spine? I don't like what I see there. I want to do something about that. And I'm like, all right, let's talk about it. Okay? Questions?